It's not a very easy exam to pass, unfortunately, and it's extremely competitive and very expensive. It was tough, but then having been prepared for the examination, it helped us to understand the protocol of practicing dentistry in the UK. It is expensive. Living in the UK is definitely expensive, depending on where you're living. So somebody who's living in London could be ending up paying much more in terms of accommodation, travel, food. The initial days were definitely tough, being the Department of Health in the UK had a shortage of dentists in the UK.
Hi viewers, welcome to my channel Dental Treasures. So this episode is especially for the viewers who's planning to settle abroad. I'm sure most of us will have a lot of queries regarding the same. Fortunately, we have the right person with us who's going to clear all our queries. I welcome Dr. Shilpa Enla to clear all our queries. Dr. Shilpa Enla is a dental consultant with an experience of 17 years, having been trained in the UK with a foundation training from the East of England Deanery and Masters in Aesthetic Dentistry from King's College, London. She takes pride in her work and particularly enjoys cosmetic dentistry. She's now engaged in private practice in Whitefield, Bangalore. I welcome to my show, Doctor.
Thank you, Dr. for this great introduction. It was very nice of you to do this program today with us.
So, Doctor, what made you choose dentistry?
To be very honest, I did not aspire to be a dentist as such, but like most other graduates who come out of medical dental school, their first choice usually would be to be a doctor, a medical professional. And when you don't get into a medical seat, the option next that you prefer is a dentist seat. So that's how I ended up being a dentist. But now that I've been in practice for over 17 years, I definitely enjoy the field of dentistry.
So, when have you decided to practice in UK?
It so happened that when I just graduated back in 2005, the Department of Health in the UK had a shortage of dentists in the UK. So they happened to bring the exams to India, the qualifying exams for a dentist to practice in the UK. So it was a really good chance for somebody like me to attempt such an exam. So that's when I just took up the exam, and I so happened to pass the exam, and that's how I do this.
I'm sure to clear the exams was not an easy task. Can you please explain the challenges that you faced during your examination?
The examination for a candidate to practice dentistry in the UK back then was called the International Qualifying Exam, the IQE. So it was essentially 3 parts, and it's not a very easy exam to pass, unfortunately, and it's extremely competitive and very expensive too, even back then. For somebody to actually even venture into the journey of passing the exams, it was not an easy feat. Still, we managed to somehow. There was a group of us who were interested in practicing in the UK, so we got together, we were a group, we got trained, and yeah, we happened to pass the exams.
So, what was your reaction once you cleared these exams?
It was particularly a very stressful period. It was almost pre-IQE, post-IQE kind of life that we had. So it was a huge relief to have passed the exam, and then, yeah.
How was your initial day of practice in UK? Were you able to get adjusted?
The initial days were definitely tough, being a fresh graduate, even from India. I didn't really have much experience practicing dentistry, neither in India nor in the UK. The challenges were such that we're not really trained well enough in cross-infection control procedures, the safety protocols, and the way we do dentistry is so very different to how dentistry is practiced in the UK. So it was tough, but then having been prepared for the examination, it helped us to understand the protocol of practicing dentistry in the UK. So that really helped because we had quite a lot of groups that would help us with how to go ahead with being a dentist and how things have to be practiced in the UK and such. So it was initially very difficult, But then as we got along, it was
Also, doctor, can you please elaborate on the cost of living, especially the food, accommodation, and travel?
it is expensive. Living in the UK is definitely expensive depending on where you're living. So somebody who's living in London could be ending up paying much more in terms of accommodation, travel, food than somebody in a remote place in the UK. But it wasn't really so much a problem once a dental graduate could find a position in a practice to start practicing dentistry. It really didn't matter much later.
Were you comfortable working with different nationals back in the UK?
Definitely. London, especially when I started practicing as a local dentist in various practices in London, it was definitely a melting pot of various nationals working in dental field. So you had an opportunity to see how each one of them practiced and how they communicated with patients differently. And yes, it was different definitely, and you would learn from each one of them, and you would have your own method of you develop your own method of communicating with your patients, or you would learn from them and then develop it. So yes, it was definitely nice working with a lot of nationals.
Also, doctor, how was your work time back in UK, and when do you take breaks?
So when I first started off, I started off as a vocational dentist, a vocational trainee. So I was on a salaried position at a dental practice. I was expected to work from 9 till 5 p.m., 9 a.m. till 5 p.m. in a practice with my trainer in the premises. So we had an hour of lunch break, but otherwise we were largely occupied seeing patients, but not on a large numbers. Work Saturdays covering for somebody who's not present at work, but otherwise we were given plenty of time off work. And eventually when I gained some experience and moved practices, I was only working 4.5 days a week. So that gave me enough time to spend with family and for other hobbies that I was pursuing there.
So, doctor, what is the average pay scale for a dentist in UK?
You could expect an average dentist to earn anywhere between £40,000 to about £100,000 per annum.
I believe clinical documentation is very critical. Can you please elaborate on that?
The clinical aspect of dentistry, the administrative aspect which involved clinical record keeping and health and safety protocols, keeping up with the latest updates on how to on how to keep a patient safe. All these things involved a very rigid mechanism of record keeping and strict. A candidate is expected to either meet or exceed the standard of a just passed UK graduate in the UK. So, in spite of all your experience in India as a practitioner, it would have been a totally different thing altogether working in the UK, work with all the aspects that we just discussed before. So, it was different, but with a lot of help and support, we were able to wade through the procedure.
Is it true your X-rays also get audited?
Absolutely, yes. So there's always an audit on how the clinical records are being maintained in a practice. So the grade of an X-ray is of importance as well. There's an audit which is conducted, and then if the CQC or the authorities were to find that the grades of the X-rays are pretty poor, the dentist could be under scrutiny.
So when can a person open their private practice?
Anybody can work as either an NHS dentist or in a mixed practice being an NHS dentist and a private dentist, or they could set up their own private practice. As long as they're registered in the UK, they're qualified to practice in the UK, they can set up private practices. And they can own practices as well.
Approximately after how many years can they open their own private practice?
There's no restriction on how much time one would need to set up their own private practice, but the private practice has its own pitfalls and it's under a lot more scrutiny because patients do pay for this treatment on a much larger scale. So the expectation is that a practitioner be really prepared for a lot of challenges. They need to be prepared to not do anything less than excellent work. So that would be a challenge for somebody who's only just learning the ropes of practicing in dentistry to be a private practitioner. Most Indian dentists that I know have started off working for the NHS, and then eventually, once they were confident about themselves, about the way they work, they did open up private practices or they become practice principals.
Also, doctor, you mentioned about NHS. Can you just elaborate what is NHS?
NHS is the National Health Service, which is largely funded by the people's taxes. So NHS services in the UK are free medically, but not dentally. So there's a charge to pay for most patients, but there's also an exemption for a few patients on the NHS for the dental charges. It's a different system altogether to the one that we practice in India.
If things go wrong during any procedure, so what should be the first step that a doctor should do? And also, is there any legal proceedings for this?
Right. So the first thing, any dentist, it's a dentist nightmare. Things can go wrong and they can go terribly wrong. So the first thing any dentist would do is to inform the patient about what's gone wrong, because not keeping the patient informed about what has gone wrong would be a huge offense. I mean, all of us make mistakes, but keeping the patient informed about it helps in the long run. Yes, I mean, medical legal problems are huge in the UK. So it is mandatory for a dentist to have an indemnity insurance of their own, so without which he cannot practice dentistry in the UK. So in such an event, in such an unfortunate event that something goes wrong during the procedure, you would inform the patient, you would send all your notes to your indemnity provider, and they would advise you on how best to go forward. That a candidate would want to find out would be available on a website called General Dental Council UK. The exam that we took was the IQE, which involved part A, B, and C. I believe the examination now costs anywhere between 2,500 to 3,500 pounds, which is really expensive. Plenty of coaching places in the UK, in India, which give help to candidates who want to practice.